Great, you've made it. You're on the surgery schedule. We've determined that you're a good surgical candidate, that the benefits of the surgery outweigh the risks, in our opinion, and I'm going to tell you what to expect going forward from here. On the day of the operation, we're going to do the surgery laparoscopically. You go under general anesthesia. The surgery takes anywhere from 30 minutes to an hour of my time once I get started. You're in the operating room a little bit before I start and a little bit after I finish, and then recovery room. So your round trip's usually about 2 hours. I will go out and speak to your family the minute we are finished with the operation, let them know how things went. You'll go to the recovery room and then you go to the floor. Once you're up on the floor, within 4 hours, I'm going to need you up and walking. That's important for avoiding blood clots. It may be the most important thing you do for yourself around the time of the surgery. After 4 hours, we're going to give you something to drink, and you're going to be on a low sugar, clear liquid diet for the first 7 days after the operation, starting 4 hours after surgery. That means you can have broth, you can have iced tea, you can have sugar-free popsicle, anything that's a clear liquid that doesn't have soft or solid material in it and that isn't too sugary. For example, apple juice, that would have too much sugar in it. Overnight, the nurses are going to check your vital signs and I'm going to come around and see you in the morning. If everything is fine, you're going to go home early the next day before noon. When you go home, you can do your activities of daily living. You do not need special assistance from somebody else. You can go up steps, you can take care of yourself in the bathroom or the shower. I do not want you doing any heavy lifting, more than 20 pounds, and I don't want you doing anything strenuous for the first 3 weeks. But normal things around the house you can do as soon as you get home. When you go home, you're likely to have some discomfort. We'll prescribe some pain medication for you. Take it if you need it, don't take it if you don't need it, start at the lowest dose. Some patients have nausea, although many do not. If you're feeling nauseated at home, we're also going to prescribe a medication for that. Place it under your tongue and let it dissolve. Your medications that you normally take, we are not going to take as full pills or capsules. So if there's an essential medication that you need to take that first week after surgery, I need you to crush it up and take it with water, or if it's a capsule, open it up. I'll discuss with you which medications you would need to take during the first week. Stay on the clear liquid diet. Broth, iced tea, sugar-free popsicle, sugar-free jello will be okay. Caffeine is okay in the first week, and coffee is all right, but please don't add any dairy or creamer to it. I will see you in the office after 1 week. I will check your incisions, talk to you, we'll check your vital signs and make sure everything's going okay. If everything is okay, we're going to switch you over to the soft diet. Soft is anything you can mash up with a fork that's low fat, low sugar, high protein. Examples would be eggs, oatmeal, well-cooked vegetables, beans, even flaky fish. Don't take anything solid like chicken or salad yet. We're going to stay on the soft diet for 3 weeks, from the end of the first week to the end of the first month after surgery. At your 1 week visit, we're also going to start you on your vitamins. There are 2 things that we ask our patients to always take: a multivitamin and calcium and vitamin D. You're going to take those every day going forward from the first week after surgery. Approximately a month after surgery, you're going to switch over to the solid diet. That just means you don't have to be able to mash it up with a fork anymore. Chicken, salad, even bread would be okay at this point. We don't ask you to come in for the 1 month visit. You just make the change to the solid diet on your own. I'll see you again at 3 months, 6 months, a year, and every year after that. When you come in for those visits, we'll check your blood levels and make sure everything's okay. That's the clinical path going forward and what we expect all our patients to do after surgery.